Everyone, Dr. Brooke Kolesiak from Legacy Physical Therapy. Have you ever felt pressure or a bulge in your vagina? If that's the case, then tune into the video today. We're going to be chatting today about something called pelvic organ prolapse. June is actually Pelvic Organ Prolapse Awareness Month, and this is a condition that I commonly work with here at my clinic that many women are dealing with. So today I want to go through a few simple things for you. First, what is pelvic organ prolapse? What are the common symptoms that you may be experiencing? What potentially causes it? And what are some things you can do to try and prevent it or treat it? So first and foremost, what is pelvic organ prolapse? So our pelvic organs, you can kind of think of them as sitting in the bowl that is our pelvis. And our pelvic organs are our bladder, and urethra, uterus and vagina, and rectum and anus. And a prolapse of these organs is a drooping or a tipping down of these organs. And most commonly, they kind of tip into the vaginal canal. And so this can happen to just one or many of these organs at one time. So the bladder can kind of tip back into the vagina. The rectum can tip forward into the vagina. The uterus itself can kind of fall down into the vagina. And even if you have had a hysterectomy, you are still at risk for having prolapse. The vaginal vault itself, just the vaginal canal, can start to tip in on itself. So this condition has many different potential symptoms that go along with it. And that is because the symptoms oftentimes go along with what organ is prolapsing. So what are some of the common symptoms of pelvic organ prolapse? It can be a feeling of pressure or fullness in the pelvic area. Maybe you visibly see a bulge in the vaginal canal, or it actually protrudes outside of the vagina. You might be experiencing low back pain or an ache in your low back that's not going away. You may be having pain with intercourse. General feeling like something is falling out of the vagina. You may be experiencing some urinary issues such as bladder leakage, or difficulty starting the stream, or feeling like you're unable to empty all the way, or feeling like you always have to go. You can be experiencing bowel issues such as constipation, difficulty evacuating the bowel movements, or changing your ability to have a bowel movement. You may even be noticing some spotting or bleeding from the vaginal canal. So symptoms really kind of depend on which organ is affected and how severe it is. Okay, so we talked about what a pelvic organ prolapse is, what are some of the common symptoms, and now we're going to talk about what some of the common causes for pelvic organ prolapse. So in general, anything that puts increased pressure on the abdomen can lead to pelvic organ prolapse, and many things can do this. The most common causes are pregnancy, labor, and childbirth. So women are at risk for this if they have had pregnancies, and especially if they have labored and delivered vaginally. But women who have had C-sections are also still at risk. So it's not, it's not either or. So that's kind of one of the biggest risk factors. Another risk factor is obesity. So carrying lots of extra load down through the pelvis over time is hard on it. People who are dealing with respiratory problems, so dealing with lots of chronic long-term coughing issues, really that pressure over and over again through the pelvic area from coughing really puts a lot of extra force down through the pelvic area and puts you at risk for pelvic organ prolapse. If you've been diagnosed and treated for any pelvic organ cancers, because that changes the treatment and all that goes along with that, changes the consistency of the tissues down there, and some of the support that may be around is not necessarily as good as it used to be. And one that people are commonly not aware of is if you have had a hysterectomy, which is a removal of the uterus. A lot of women think that because they've had that, they are not at risk for pelvic organ prolapse anymore. But the case is that you definitely still are at risk, and just the act of the removal of the uterus changes some of the supporting ligaments that are around the area, and puts you at potentially more risk for prolapse down the road of different organs. So don't assume that just because you had a hysterectomy that you cannot get prolapse, pelvic organ prolapse. You are actually at a greater risk for it. Genetics also plays a role. So in whether or not you get pelvic organ prolapse, so the consistency of our connective tissue is weaker in some women than others. It has a lot more laxity and give, and that perhaps places those women a little bit more at risk. All right, so we've talked about what a prolapse is, what are some common symptoms, what are some common risk factors for it, and the fourth thing we're going to talk about is what you can do to try and prevent pelvic organ prolapse. And unfortunately, many of the risk factors for pelvic organ prolapse are out of your control, such as your family history, how old you are, whether or not you had a difficult vaginal delivery, whether or not you have already had a hysterectomy. So those things you can't control, but you can reduce the likelihood that you will develop problems. And there's a few things that you can try to do that. So let me go over some things that you can be doing. First, you want to make sure that you have a strong, supple, supportive pelvic floor. So remember how we talked about the organs as the bowl inside the fruit that is the pelvis? Well, the bowl, the bottom support, are our pelvic floor muscles. So that's stress and strain on the pelvic organs that are up above. So that's the first thing that you can do is making sure that you have a strong, supportive, and supple pelvic floor. Second, you can maintain a healthy weight. Remember, obesity is a risk factor for pelvic organ prolapse. And if we maintain a healthy weight, we take a lot of pressure off of our pelvic area. Third thing we can do is don't start, or if you have started, try to stop smoking. So smoking affects tissue and can damage our tissues throughout our whole body, and so that they don't heal or aren't as supportive as they could be. And the chronic coughing that's often seen in smokers puts a more pressure through the pelvic floor. So please, try to avoid smoking and make sure that you are getting treated for any chronic coughing condition. And another thing that you can do is to maintain healthy bowel habits. So we want to avoid constipation. So if we're having to do a lot of really forceful straining to have a bowel movement, that's going to repetitively put a lot of stress down through our pelvic floor, and we don't want that to be the case. So those are four things that you can do right now to make changes to helpfully prevent pelvic organ prolapse. So we talked about what pelvic organ prolapse is, what are some common symptoms, what potentially are some causes or risk factors for pelvic organ prolapse, and we talked through some things that you can do to help prevent.